So good afternoon. My name is Peter Nilsson from the Lund University in Sweden. I'm a professor of clinical cardiovascular research, and now I have enjoyed 3 days of this scientific meeting in Milan, ending today. We have heard many nice presentations, and I would just like to give a few comments. Hypertension is a global problem, and the new guidelines, European guidelines from last year, propose to use simplified approach, the single drug fixed combination drug like combination therapy very early on, important, but also to treat the other risk factors. My special interest is diabetes, and now we see an emerging trend of new anti-diabetes drugs with some positive effects also on blood pressure. We are still not fully confident how it works, but for example, both the SGLT2 inhibitors and the GLP-1 receptor agonists lower blood pressure to some degree. I think that's interesting. Another hot topic here is renal denervation. A few years ago, that was a hype, everybody was interested. After that came a backlash, some negative studies or neutral findings. Now with new devices is a new emerging interest, wider interest, and the real challenge is to select the appropriate patients with resistant hypertension to be treated with renal denervation. Studies are ongoing. Another interest of mine is arterial stiffness. Pulse wave velocity, that can be measured directly but also indirectly. There are many devices, as also shown here at the exhibition. I think it makes a lot of sense to better characterize vascular age, because you may have a person 80 years old but rather fit with a vascular age of, let's say, 60, 65. But on the other hand, you have a 35-year-old man with adverse lifestyle, risk factors, and a vascular age of about 50. So then you can tell the patient about this, like a motivation to change for better lifestyle, also to accept drug therapy. One leading expert is Professor Stéphane Laurent from Paris. He lectured here. There was also an award in the name of Michel Safar, another Paris researcher on arterial stiffness, that founded what has been called the Paris Vascular School. Finally, I would like to mention that in clinical research, we are interested in the bad things like morbidity, mortality, cardiovascular events. However, in academic research, we can also flip the coin to look at the lower distribution of risk, like people with very normal arterial stiffness in relation to their age. Of course, they shouldn't be treated, but if we can investigate why they are protected from vascular aging, that could bring us insights, and eventually, if we understand the mechanism, even new drug targets. But so far, we need to combine various antihypertensive drugs, treat all the risk factors, and increase awareness on a global scale. Thank you very much.